Osteoporosis, osteopenia, the loss of bone density, the thinning of your bones. Hi, I'm Dr. Peters of Peters Wellness, Chiropractic and Massage, and in this week's quick video, I'd like to discuss the loss of bone density and what we can do about it, what you can do about it. If you are a female, especially under the age of, well, let's just say premenopausal or postmenopausal, I think it doesn't matter where you're at because either way it's important. If you've already got osteoporosis, things that you can do to prevent more bone loss, or bone density loss, the thinning of that bone, or if you're osteopenic, which is osteoporosis to a lesser degree, it's not as bad. And then the other thing is if you don't have either of them, what you should be doing, what you should be taking supplement-wise to make sure you protect yourself against osteoporosis or osteopenia. So chiropractically, what can that do? A lot of people think chiropractic, oh my gosh, if you have this, you shouldn't see a chiropractor. No, we're trained to make sure that we do things in a way to help protect you and get your joint mobility moving. All the adjustments don't need to be hard and forceful. There are gentle adjusting techniques, tools that we can use to be able to work on people who are more fragile. The oldest patient I've ever worked on, I believe the date is 93. He's 94 now, but he was 93 when I worked on him. So just because someone is older doesn't mean they can't have or receive chiropractic care. So number one, increasing range of motion with chiropractic care. If you increase range of motion, less chance for injury. And also getting adjusted can increase your muscle strength. So if your muscles are stronger, less chance of injury. And also it's going to increase neurological function. Getting adjusted increases neurological function. So if your joints are moving better and better range of motion, your muscles are stronger, and your nervous system is functioning better, obviously is less chance of injury when you go and do the physical activity that you need to do. Number two, exercise. Weight-bearing exercise is excellent for bone density and keeping your bone density strong so that you have less risk for osteopenia and osteoporosis, or that bone thinning that we're talking about. The last thing I want to discuss is talking about nutrition. What can you do nutritionally, supplemental-wise, to protect yourself from osteopenia and or osteoporosis leading down that road, that path that we don't want to go down? So the first three, typically people take them together, and I grabbed this. Calcium, magnesium, and vitamin D, okay? This is one that I've been taking for, I think, about 3 years. Originally, I just picked it up at Sprouts, and now I buy it, so I have it here for my patients. Calcium, magnesium, vitamin D. I even looked it up and get it on Amazon. I think it's like $14, $15. I may have it more, but I don't sell as much, but I don't care where you get it. I just want you taking something. Cal Mag D. So when it comes to calcium, magnesium, vitamin D, your magnesium ratio should be about a 2-to-1 ratio. So about 1,000 milligrams of calcium and 500 milligrams of magnesium. Your vitamin D, typically I think is 400 IU is the recommended amount. Now, I take a lot more than that personally. I know what I like and what I function well on. But these things, taking these things together is going to help your body and protect you against bone thinning and bone loss. Also, the next thing, so we got calcium, magnesium, vitamin D. Then we're going to talk about, well, in my office, I sell a product called Energy Stress. But this is loaded with B vitamins. Why? Because B vitamins are awesome to help you, number one, sleep better, but they also give you energy. It's like, it's the, what is that, yin and yang, right? It does both. It gives you energy, but also helps you sleep well. And again, I take a large amount of this, but just, thinking of the RDA and do your own research and see. But I take this every day because I want to make sure I get enough of my, the key ones they're looking for bone density is going to be your B6, your B12, and your B9, or 6, 9, and 12, however you want to say it, B6, B9, B12. And typically you want to take your B vitamins always as a complex, take them together. And that's why I like these particular products. And they're liquid, so liquid form. Now, I've carried different calcium supplements in liquid. I just myself, I couldn't wake up and take it every morning. So I do take that in pill form. But it's in a capsule. It's not a solid pill. Because I have seen calcium supplements on x-ray in someone's large intestine. So if it's passed through the stomach, the small intestine, and gotten into the large intestine, you're not going to absorb it. Okay. So a capsule is going to be much better, or a liquid form. But I haven't found a good calcium liquid form that is just palatable. And I take my stuff every day. Typically, I do everything twice a day, once in the morning, once in the late afternoon or early evening. Also, I wanted to talk about, as I finish up, the tests that you can take for checking your bone density is called a DEXA scan. A DEXA scan, looking at it, is talking about a dual energy X-ray absorptiometry. It's kind of a weird word, absorptiometry. So it's a DEXA scan. That's all you need to remember. And I refer most people over to Valley Radiologists. They have a DEXA scan. I have my own DEXA scan done. But this is the chart. And actually, I just did a post on Facebook with this chart. But it talks about normal, low bone density, and then osteoporosis. So the normal bone density is basically from a +4 to a -1. And then from a -1 to a -2.5 is considered osteopenia. And then from a 2.5 to, well, -4 or below would be osteoporosis. And the DEXA scan is basically measuring you and your bone density against like a 30-year-old. That's kind of the average. In the somewhere, I think it's in the mid-30s is where our bone density is the greatest. So the DEXA scan is like the ultimate scan, the ultimate test to know what your bone density is. If someone has osteoporosis and you take an X-ray, if it's bad enough, you can see the bone thinning, but a DEXA scan is definitely a better scan now. And I think they're very available. I think every 2 years is what you tend to do when you start doing those tests. And then if you're on a medication for it, then they'll do it every year to make sure that the medication is doing its job. So I've covered getting adjusted to increase your chances, reducing osteoporosis, osteopenia. Number 2 is getting that physical weight-bearing exercise. And number 3, I talked about, I missed the last supplement, potassium. But the reason why I left it out is because in researching potassium, what you'll find, if you just Google it, you're going to see that potassium, most people in the Western world do not need to supplement potassium. We get enough potassium in what we're eating. However, if you've been diagnosed with a potassium deficiency, then typically is when you would take a potassium supplement. So that's another key ingredient, but typically people do not need to be taking that unless their diet is just really bad or they have some type of problem going on with their system and they're not getting enough of that potassium. So have an amazing week. And if you know somebody, think about sharing this video, especially with anybody you know, female-wise. A lot of times we talk about things where it's like, well, I'm a man, I don't have to worry about it. Yeah, but you know what? I bet there's a woman out there that you love somewhere, your mom, your sister, someone you know that should have this information, because how easy is it to take some pills, some supplements every day? It's easy, and it could prevent something, because once someone has osteoporosis, osteopenia, falls and has a fracture, life expectancy is shortened. And quality of life also not as good. So have an amazing week. Get this information out there. Keep an eye out. I'll be doing different posts also. I shared a post earlier today from Osteopenia, I believe it's Osteopenia Foundation. Great article I was reading. Check it out. It's on Facebook. I think you'll love it. And have a great week.